Hi, my name is Jamie. I'm the head nurse at AccessCare Vascular, and I will be overseeing your care at our facility. Today I will be overviewing what you can expect the day of your procedure at our facility, as well as what your vascular surgeon will be doing during your angiogram. We hope that this video and our website will help educate you and your family on your angiogram procedure, and help to put your mind at ease as we partner together to improve your circulation. Your angiogram procedure will take place right here at our outpatient facility. With over 10 years of experience, we pride ourselves in being the first vascular center in Buffalo to safely and effectively perform angiograms outside the hospital. Your procedure at AccessCare will offer you many advantages, including free and accessible parking, discharge home the same day, personalized and direct care with our hand-selected clinical staff, and avoidance of some of the common hassles of the hospital, including parking, staff shortages, and hospital-acquired infections. Peripheral arterial disease, or PAD, is a blood vessel disease that most commonly affects the arteries in your legs. The arteries in your legs are responsible for supplying the legs and feet with blood and oxygen. However, aging and certain other risk factors, such as smoking, diabetes, and high cholesterol, can cause the buildup of fatty substance called plaque in the arteries. Over time, the plaque begins to accumulate in the arteries, which limits the amount of blood flow that can reach your legs and feet. The most common symptoms of PAD include calf cramping and leg pain while walking. This is called claudication and is due to lack of adequate blood supply to your leg muscles, which causes them to tire easily. In addition, some patients have leg and foot pain at rest or non-healing wounds due to inadequate blood supply. The purpose of your angiogram is to assess your arteries for plaque and improve your circulation to hopefully alleviate your symptoms and allow you to be the best version of yourself. So on the day of your procedure, we will have you get dropped off about 1 hour prior to your scheduled procedure time. When you arrive, you'll be met with our clinical staff and taken back to recovery, where we will check you in. Check-in includes paperwork. We get you all settled in, we talk about the procedure, and we get an IV going for hydration, and that's how you'll get your medication. After we get you checked in, we'll then bring you into our procedure room, where we will get you prepped for your procedure, and we'll start your conscious sedation. The procedure is done under conscious sedation. We do not knock you out or put you under. We give you enough to make you comfortable. If at any time we can work with you, if you feel anxious or any pain or anything like that. The procedure itself is not painful, but we do try to make you as comfortable as possible. Your vascular surgeon will then apply local anesthesia to your groin. You may feel a little pinch and burning sensation at first. However, the area will become numb and you just know we're working there. You shouldn't really feel any pain. Your vascular surgeon will then make a minimally invasive puncture in the groin with a needle to access your artery. They will access the artery on the leg that is not being treated. After the puncture, when access is gained to the artery, they will guide wires and long thin tubes called catheters in your arteries and over to the leg with the plaque. This technique allows the surgeon to be able to access and visualize all of the major arteries in your affected leg. Next, the surgeon will inject contrast dye in the vessel and will use X-ray technology to visualize the blood flow in your leg arteries. Throughout the procedure, you will be monitored by surgeons and nursing staff, and they will communicate with you the steps of the procedure and adjust your sedation as necessary. The procedure itself usually takes about 1 to 2 hours. It requires you to be laying flat. After the contrast is injected in your leg arteries, your vascular surgeon will assess the images to locate any narrowing and plaque in the arteries that needs to be treated. After the plaque has been identified, your vascular surgeon has multiple endovascular devices at their disposal to improve your circulation. Angioplasty is when a wire is first guided across the area of plaque and a small deflated balloon is then placed in the area of narrowing in the artery. The surgeon then inflates the balloon to push the plaque up against the artery to widen the blood vessel. Sometimes afterwards, a hollow metal stent is placed over the area of narrowing to act as a scaffold by propping open the artery. These stents are very flexible and are designed to twist and turn with the body and artery movement. Anthrectomy is sometimes used to mechanically remove plaque from the artery. A small rotating burr is guided to the area of plaque. The vascular surgeon then activates the burr, which rotates and breaks apart the plaque. The plaque is either sucked out of the artery or ground up into microscopic pieces and eliminated by the body. Last, a completion angiogram is performed to assess and improve circulation. At the end of your procedure, your vascular surgeon will either use an artery closure device or will hold manual pressure over your groin to seal the artery puncture site. After your procedure, you will be transferred back to the recovery room, where you will be monitored closely by our clinical staff as your sedative wears off. You'll need to lie flat for at least 1 hour after the procedure, as your artery puncture site heals. Plan on spending anywhere from 2 to 4 hours after the procedure with us. You'll have drinks, snacks, lunch, and TVs available as you recover. Your nurse will go over your discharge instructions with you at that time. Some of the most important instructions include having someone to drive you home. You will not be able to drive after your procedure that day. You'll need to take it easy for the next 72 hours. I like to tell people to plan ahead, get your grocery shopping done, get your laundry done, set yourself up to allow yourself for a couple days of relaxing. So no heavy lifting, pushing, or pulling for about 72 hours. Heavy is about a full gallon of milk. You really do not want to lift anything over 10 pounds for the next couple days. No showering the day of your procedure or the next day. You come in, you can take your bandage off 2 days after your procedure. About 1 week after your procedure, you can get back to normal activity. If you have any additional questions, please refer to your surgical instruction sheet, our website, or our clinical staff for more information. And thank you for choosing AccessCare for your vascular needs.